doing? Hi, I'm just laughing. Hi, everybody. Welcome back to Ask Away Health. And thank you so much for joining me tonight. We're tackling another batch of questions that are coming from you guys, the viewers. And I'm really happy that you could take a few moments out of your time to share with me. Tonight's session, we're going to be covering how a wart was misdiagnosed. And like I said, this was a question, or this actually is a comment that was sent into the channel. So we're going to look at it, look at the issues around it. I think it was very useful. I think it's very useful in terms of education. So we're going to be looking at how a wart was misdiagnosed for a type of cancer. We're going to look at the unusual shape of the cervix and how it's creating some complications for the person who sent that question in, a challenge around menopause, and an issue around PCOS treatment options that I observed on one of our community polls. We're going to be discussing all that, hopefully within the next half hour to 45 minutes. And hopefully you will learn something from at least one, if not all, of these sections or these topics that we're going to cover tonight. Thank you so much for joining. Please don't forget to give this video a like, and of course, consider subscribing to the channel. That will be much, much appreciated. As well, I would love that if you've ever experienced any of the kind of topics that we're going to be talking about tonight, let us know if you're happy to share what your experience was, how it compares to that what we're going to be talking about, what kind of outcomes you had or any concerns you might have around them. So let me just say hi to the guys on TikTok. Thank you so much, guys, for joining. I really appreciate you popping in. I'm going to say special hi to you guys in a moment, but let me just get straight into the questions. Before I do, though, if you guys are finding this, kind of Q&A sessions that we've been doing from the beginning of the year useful, please don't forget to like this video. And of course, don't forget to check out the description box below the comments, below the video, especially on YouTube, because you're going to find a link to our website. And on our website, askawayhealth.org, there's so many different things that you can do. You can join our mailing list for a monthly newsletter that's packed with helpful health tips. You can get access to our free symptom checker for guidance on any health concerns. And of course, you can send an email health inquiry. I get a lot of health questions on my channel, and sometimes I can provide general information to give us guidance. But if you want a specialized, customized response from me or one of our expert clinicians, please use the email inquiry tool. And so this is a good time for me to share with you the disclaimer that just reminds us that I'm not providing medical advice. I'm not providing any treatment. It's really important that we say this is for general education and information. This is supposed to encourage you to go back and speak to your own medical practitioner who knows all your medical background and who is able to provide you with the information that you need, the treatment and the advice that you need specifically for your own person. So let's get started. Let's get to the first question. I'm showing it on the screen. I'm going to be reading it out for you guys on TikTok so that you follow along. So this commenter says, here is some free advice. I love the way they started this. And I'm reading this verbatim. This is exactly how it was sent into the channel. Here is some free advice. If you've got the warts and you're feeling warty, honestly, this is how it came. Don't take your doctor's word for it. Do a biopsy, they said. My doctor gave me wart cream. It turned my brown wee white, only to find out it's a tumor. In bracket, they put lymphangioma. Do a biopsy. Make sure it's wart. Save yourself the pain. So guys from YouTube, thank you so much for liking, guys. Really appreciate that. So guys on TikTok, let me read the question again so that you follow. So somebody says, here is some free advice. If you have warts, or you feel that it's a wart, don't just take your doctor's word for it. Do a biopsy. And they said that the doctor gave them wart cream. but all it did was it turned their brown wee wee white. I don't know what he means by brown wee wee. Maybe you guys know. Please let me know in the comment section what wee wee means, only to find out it's a tumor, a lymphangioma. And so the advice is do a biopsy, make sure it's a wart, save yourself the pain. So, well, this is obviously somebody who is not very happy with how things went along with their doctor. I can understand, I can appreciate that. But let's go into a bit of detail about this issue that they've presented, okay? So the thing about warts, which of course, as you know, is caused by the HPV, human papilloma virus. And by the way, my latest video on the channel on YouTube is around genital warts, particularly things that don't cause it to spread. And I think that is an area of misinformation, and I've shared that video. I hope you guys will go and check it out if you're interested in talking about or learning about genital warts. But going back to this particular comment, it's often a clinical diagnosis, and what that means is that your doctor is going to examine, have a look at the wart wherever it's located, and based on its appearance and the information you tell them about how it started is generally the way that they'll come to a diagnosis, and then provide you with the treatment, which can be any list or any host of different possible treatment options. We have quite a number of different treatments that we have for warts. Again, I have a video in my channel completely dedicated to different treatment options for genital warts. So it could be a topical, wart cream, which is what this individual that we have that presented this comment to us. And that's what they had. Now, usually if it is a wart, it should within a few weeks to months begin to show evidence of cure or of improvement. It should start getting better. It does take some time. Wart cream treatment takes some time to start working. It's not a quick thing like that, just to bear that in mind. However, the crunch is this. If the wart doesn't look like a typical appearing wart, that's the first hint. If it doesn't behave the way a wart should behave, and is not responding to the usual treatment, or it's changing in the way it appears, or doing things like getting itchy or bleeding, that sets off alarm bells, because it suggests that perhaps we're not dealing with a wart. And I think it's really important that people, if you're experiencing things like that, if you're on the side of the person who knows or who has the wart, if you notice that it's not getting better from the cream that you're using after a few weeks, if you notice it's changing, it's getting itchy, it's bleeding, then those are the things you need to bring to your doctor so that they can look at that diagnosis and check, right, could this be something else? And on the other hand, when the doctor is looking at the wart, it's important to say, does this really look like a wart? So that's a question that we need to ask ourselves. Does this really look like a wart? So on the screen, for those on YouTube, Facebook, LinkedIn, I'm showing you some images of warts that we might have. So it could look from anything like smooth or rough, small or large, sort of like polyps or pushing up from the surface of the skin, looking like it's stuck onto the surface of the skin. They could look in different ways. And if we as doctors are not sure and it doesn't look like a typical wart, then generally we will be looking to get further tests done, and they can include things like biopsy. Now, remember at the beginning I said that a wart, we generally diagnose it by sight. We just look at it. We don't do blood tests to diagnose the wart. We don't do anything else generally to diagnose a wart. And warts are very, very common. So imagine if we have to go and biopsy every single time that we see a wart. It may not be productive. It may be that we're putting people under a lot of anxiety. So that's generally because it's common. That is a wart. It's benign. We generally use clinical diagnosis. And for the reasons I've mentioned already, if it looks atypical or looks unusual, if it's not responding to treatment, or if it starts to change, for those reasons are the times that we would usually recommend a different course of treatment like a biopsy. But going back to this person who wrote in this comment or this question, they said what they had was actually something called a lymphangioma. And a lymphangioma is a benign growth. It is a type of tumor, and it's benign of the lymphatic system. So it could appear, I think it probably mimicked the appearance of a wart initially to the doctor, which is why when they first saw them, they ended up prescribing a wart cream for them. But it's the lymphangioma is a benign growth of the lymphatic system. And the lymphatic system is something that we have, all of us have all around our body. Lymph is a watery liquid or fluid that bathes the entire body. Okay, it flows. You have lymph vessels that flow similarly to the blood vessels, and lymph is formed from a part of the blood. And what it does, your lymph does, is to transport nutrients to your tissues from the blood, or from the tissues it collects waste material or collects debris or germs and all that, and transports it away from the tissues into the blood for it to be dealt with by the body. So you have lymphatic vessels carrying lymph. You also have lymph nodes that many of you will be familiar with. For example, when you have a throat infection, you have swollen glands underneath your neck or along your throat. Those glands are lymph glands. They contain lymph, this fluid I've just been talking about. So this person had a benign growth of their lymphatic system. That's what they had. The treatment, of course, will clearly be different to a treatment for wart. And so they're making the argument for biopsy. And I fully understand why they will make that argument. But let's put it in context, okay? Because a lymphangioma is, I'm just showing you guys on YouTube, Facebook, and LinkedIn. I was just showing you a picture of the lymphatic vessels so that you understand how it flows, just like your blood vessels. Now, going back to the comments that the person made, a lymphangioma is something that is less common, definitely less common than a wart. If you're looking at different lesions and we're trying to say, is this a wart or lymphangioma? It's probably more likely to be a wart than a lymphangioma, but that doesn't mean we should be getting the diagnosis wrong. And so because, like I said earlier, lymphangiomas are not that common, it doesn't mean that every single person who comes to see the doctor that has a lesion that looks like a wart will immediately be sent off for a biopsy. Because don't forget, you're doing a biopsy. That's a relatively invasive procedure. You're going to use an instrument, a needle or a blade or something to cut a piece of tissue from somebody's body, piece of a cell, so you can go and examine it under a microscope to work out exactly what it looks. It's not such an easy thing that you should do, and you should do it. It shouldn't be done for any flimsy reason, if I can use that expression. Not that it's not important to do. The point I'm trying to make is we need to be clear that there are certain times when it makes absolute sense. In fact, it's imperative that you should have the biopsy. And I will repeat them again. And those reasons are: one, if it's a wart that doesn't look, or if it's a lesion or spot that doesn't look like a typical wart. If it is something that we think, okay, it's a wart, and then we start wart treatment, but it's not responding to the treatment. Or if it's a growth and it's not behaving the way warts do. Warts tend, to remain the same way for, a period of time. They don't itch generally. They don't bleed. They may not change color. So there are different ways that they would sort of remain the same. And that's typically a wart. When something is not behaving like that, this is the time that you should definitely be going back to your doctor, or your doctor should be having a conversation for getting a biopsy done. And of course, a biopsy is a way to get an accurate diagnosis if, like I've said, the condition is not responding to treatment. But one of the things I love about this person's comment, and the reason why I brought it up, because I encourage advocacy, and one of the reasons I brought it up is because I'm glad that they were confident to challenge their doctor. He says, don't take your doctor's word for it. Well, fair enough, because it's your body. I expect you to come back and tell me that this treatment that I've been on for the last 4 weeks doesn't seem to be making any difference, or I feel this wart is not getting better. It seems to be getting worse or behaving differently. Keep in touch with your doctor and sort of push back and say, look, could it be something else? Because that is the way that we can work together to make sure that you're getting the best health outcome. So that's one of the reasons I wanted to bring this up. I thought it was a very good way to establish, you as the patient, empowering yourself, having the knowledge, having the wherewithal to sort of get a second opinion or push back on the doctor when you feel things are not going the right way, or if you have some instinct that makes you feel something is not quite right, please use that. Don't ignore it. Use it and speak to the doctor and say, look, I think we should take a second look at things. All right, guys, so that's the first comment done and dusted. Let me know what you guys think. Have you had something like this before? Have you had a similar experience to this kind of thing before? Or perhaps it was a situation where you challenged your doctor and you were right to make the challenge. Let me know in the comment section. It would be great to hear from you. We're going to take a quick break. Guys on YouTube, on Facebook, LinkedIn, we're going to take a quick break now, and then we'll go on to the very next one. Welcome back. Welcome back. I have a comment from Mama. Any insight on HSV? I don't understand the question. Give me some more context, Mama. And while you're at it, tell me where you're watching from. That would be great. But let us go on to the very second question. And this one is around, it's a long one. I'm going to read it out to you guys. So this is the one about the L-shaped cervix. So guys, let me read it to you guys on TikTok. So listen. This person wrote in, so this is the proper question. It says, hi, I was told that I have an L-shaped cervix and it's very difficult to reach for a biopsy of my uterus lining, which is 11. I'm 58 years old, have growing pain since the summer of 2024. And in January, that's a couple of weeks ago, or a few weeks ago, saw bleeding for 12 days. With severe cramps after 3 years of no period. I do not want full anesthesia for the biopsy. Is there another option in determining what is going on besides a biopsy? Thank you. So this is the question that we have to answer. For guys on TikTok, let me just quickly summarize this for you. So somebody who is 58, so she's postmenopausal, okay? And she's told us she has something interesting called an L-shaped cervix. Now, presumably she's had a scan and she's been told that her womb lining is thick. She said 11. So I'm presuming that she's talking about 11 millimeters, because normally we'd expect something like 4 to 5, thickness of the womb lining. So millimeters, but she said 11, which is quite thick. She's also mentioned abnormal bleeding. Any woman who has finished seeing her period, she's stopped seeing her period, she's postmenopausal, that is, she's gone 12 months without seeing her period. Any woman who then develops bleeding after that, that must be checked out. It's not normal for that to happen. We have to check it out. We have to find out why it's happened. So she mentioned all these things, and then her concern is the doctor, of course, wants to find out what is happening. The doctor wants to know why she's getting this bleeding, why is she having this pain, why is her womb lining thick. So they want to do the next set of tests, which is the biopsy, to actually examine the tissue of the womb and work out what's going on here. And she says, but I have an L-shaped cervix, and previously it's been hard for them to do any kind of test before because of this L-shaped cervix. This is what we're dealing with today. This is the question. This is the issue that we're dealing with today. So let's explore this thing. I've already said that any woman who is postmenopausal, that is, she's completely finished having her periods, she's gone 12 months without a period, she's in that age group over the age of 50, 52, we say she's postmenopausal. Anyone who comes back and then says, oh, I've started seeing bleeding, vaginal bleeding again, alarm bells start ringing, very, very serious. We do not ignore it. And then the second problem is the thickness of her womb lining, which she tells us was 11 millimeters. In a woman who over 58 is above what we expect. Usually it should be, like I said, 4 to 5 millimeters. This makes me concerned about the possibility or a high cancer risk possibility. Now, it's possible that there could be, benign reasons, maybe polyps or endometrial hyperplasia for some other reason, but it could be cancer. And that is why the doctors want to do the biopsy. So this is a big concern. This is not something that we can ignore and not worry about. Having a thick womb lining suggests cancer, not in all cases, but it's a big red flag. It needs to be assessed. So the next issue that we need to talk about is the L-shaped cervix. So guys, on YouTube, I'm just going to share with you an image of the cervix. Guys on TikTok, okay, of course you guys cannot see my image, so let me demonstrate. The image I'm showing to the guys on YouTube, Facebook and LinkedIn is of the cervix, okay? But on my model you should be able to see, okay, because I'm showing you, let me just bring it close to you, so I'm showing you the cervix, which is the entrance of the womb, okay? So that's that area, that's the womb itself. This is the womb cavity itself, yeah? So that area between the vagina, the entrance of the vaginal opening, the upper opening here, or the end of the vagina here, all the way, that's the cervical canal till you get into the proper body of the womb. So the cervix is known as the neck of the womb. And usually, the shape is like a tube, like a cylinder. It's sort of like a straight or sort of gently curved, shape that, or space, if you like, that just easily leads from the vagina into the womb. So for someone to have an L-shaped cervix, to me, I couldn't find any pictures. I would have loved to show pictures of this, but it suggests to me that there's a bend because it says L. So that L suggests that, okay, it's going straight and there's a sharp bend, the way an L is formed. So it seems to me that the cervical canal has bent, which makes it difficult. So it's not the typically straight thing that we like to see, or that usually you have within the vagina and the vaginal canal going into the cervix and the womb. It's not the usual straight channel that we see. Now, this could happen for different reasons. It could happen from birth. It could be that this is how she was born, or there could be different conditions, including things like infections, for example, pelvic inflammatory disease, or sexually transmitted infections that could have led to scarring and caused the canal itself, the cervical canal, to change and bend a little bit. Whatever it was that caused it to happen, or maybe even previous surgery, whatever it is that caused it, whether from birth or whatever, is an L-shaped cervix, and it can present challenges or difficulty when you're trying to do otherwise straightforward tests. For example, wanting to do, it may not affect a smear too much, because a smear, you don't advance too deep into the canal, but it might affect her, for example, if she wants to have a coil inserted, or if they want to do other tests like this biopsy that they want to do, and she's worried because she knows that from previous experience, it can be very uncomfortable. And I think that's why they've suggested that she gets it done under anesthesia, so that she's asleep, she's comfortable, and the doctors are able to carry out the procedure without putting her under so much discomfort. Now, she's worried about anesthesia, which, most people are probably, in this day and age, are probably used to the idea of anesthesia. However, let us not disregard the fact that it's a serious thing. This is a surgical procedure. You're going to be put to sleep, and different side effects or different complications could develop. Somebody could have a reaction to anesthesia, or some other issues might arise as a result of anesthesia and the procedure. So it's not something that we'll take lightly, and I appreciate her concern. But on the other hand, I have to balance my worry about the problem that's going on, and which we have to find an answer for. We need to find out what is happening. She talked about pain. She's getting pain in her groin or pelvic area since last summer. And then she said recently, a few weeks ago, she had bleeding. That's not happened to her for 3 years since she finished her, since she reached menopause. So like I said, we're concerned, and it's really important that we find out what is happening. I think, yes, she can sit down and have a conversation with her gynecologist or her her doctors about her worries for anesthesia. Why does she have this concern? What is she scared of? What are the issues? Can they reassure her about the procedure? Can they put her mind at rest so that they can do what they need to do to find out what's going on and start her treatment as needed? But if of course, if they're not able to prevent or provide the assurance that she needs, and she insists that she doesn't want to go under anesthesia, what other things could happen? What other things could they do? Well, she's already had a scan. It's the scan that told us that the lining of her womb is that thick, so she's already had a scan. And perhaps the other tests, like imaging tests that they could do, for example an MRI, that could tell us a little bit more. Really the gold standard is getting a sample of the tissues, really, from the cervix and from the womb, to understand what is causing the symptoms. So that's really how you would make the diagnosis. If, for example, it's cancer, that's how you'd make the diagnosis and determine the stage or the type of cancer that is going on within the cervix or the womb that is causing the symptoms. That's why they want to do the biopsy. Perhaps there are ways that they can look at using. It's tricky. Perhaps they can look at ways of introducing fluid into the womb itself, similar to the way they do an HSG. These measures might still involve having to go through the cervix. So I think it's something to have a conversation with your specialist around, in terms of alternative options to a biopsy under anesthesia. I strongly recommend that you should have the procedure, because it's important to find out what is causing the problem. I think that there are alternative ways that they certainly can use. They might decide to go for imaging like an MRI, magnetic resonance imaging, which will help to give them a closer look at the structure, but they will also need a sample of the tissue. There may be some other types of less invasive or less painful or uncomfortable methods to get the biopsy, but it's tricky, because they would still need to go through the cervix, which, as you've told us already, is difficult to reach simply because of the shape. So I think at this point, I'll say sitting down needs to be done, having a conversation with the doctor. Some of them might even decide, okay, perhaps a procedure like a laparotomy, or in laparoscopy, so that if there's any treatment that needs to be done, everything is done all together at the same time, so that they don't expose you to a biopsy today and then you have to come back and go under anesthesia again. And maybe that will reassure you if it's something that can just be done once. But it's a tricky one. It's a tricky one. First of all, I think please sit down with your doctors, have a conversation about your concerns, and then they can share with you any options that they feel will be useful, which again is difficult for me to suggest. I don't know all of your medical background, and I think they'll be in a better position to be able to explain that to you. Again, I think this was a really interesting question. I had a lot of thinking to do around what are the options, what would be the best way to go about it. But let me know what you guys think. Let me know what you think about this dilemma. What are your concerns from hearing the story that she has, and how you would like it to be approached, what you would be saying to your doctor in that position. Guys on YouTube, Facebook, and LinkedIn, please don't forget to give this video a like, especially if you're finding the information useful. I really appreciate that, and it tells the algorithm that we're doing something particularly useful. Let's take a quick break before we go on to the next question. I will be back with you in moments. Hello, welcome back. Thank you so much for watching. Let us go on to the very next question. We've tackled two, haven't we? So let's go on to the next question. So this one is another interesting one, okay? It says, I watch most of your videos on menopause, but all the symptoms you've listed happened to my mom. But for her case, it's been going on for over 15 years. Hers comes with a lot of body pain, hot flushes, anxiety or mood swings, weak legs, and the whole lot. We've been trying a cure for it, but up to now, it's still persistent. I don't know if you can advise us on what to do. That would really be helpful. Thank you. God bless you. So to be nice to hear what cure they've been trying. And I don't know, there's a lot going on, so a lot that needs to be unpacked. If I were to sit down in front of this person and their mom, there's a lot to unpack. Is it strange to be going through menopause or having menopausal symptoms for 15 years? It's not completely strange. Commonly we look at 7 to 10 years. Longer than 10 years is possible. Not so common, but it is possible. But I think if somebody has been suffering with these symptoms, I'd love to know whether they've tried any treatment, whether it's HRT or not HRT. I'd love to know what exactly have they tried. And then before we even talk about that, let's back up a little, because we're just assuming that it's menopause. Yes, they've talked about hot flushes, they've talked about anxiety and night sweats and all that. Yes, those are the symptoms that we associate with menopause. But don't forget that these are also symptoms that could happen with other conditions. I want us to remember that and keep that in mind. So yeah, it's possible that this is menopause. It's not unusual. It's not impossible that she could have menopausal symptoms and they've lasted for 15 years. Some women do have that experience, even though more commonly, many women may start to experience less of the symptoms by the time you're getting to 7 or 10 years after menopause. Some women can have quite severe or lengthy symptoms. So because of the great impact on day-to-day functioning, I can only imagine how distressed, how unhappy this lady would be, because this is just suffering. It suggests to me that going to the doctor, having a look at all the symptoms one after the other, a full examination, and then do some tests to work out what is there anything abnormal that might suggest a different condition that is not just menopause. Okay, so body pain, weakness, can we think about bone thinning like osteoporosis that could be responsible for her symptoms? Could she have mood problems that's unrelated to the menopause? I don't want us to just narrow down on menopause alone. I think it's good practice to make sure that we've not missed anything. Again, we don't know her pre-existing medical background, and I think that would be very useful to when her doctor is exploring things to work out how best to help this lady. So I don't have any cure. Let me put up the question here, because the question says, we've been trying a cure. They don't know if you can advise us, if I can advise them on what to do. My advice, 2 things, really very straightforward. And based on the information that you've given here, I think you really need to go back and sit down with your doctor. And then the first thing I want to establish is that this is being caused by menopause, because different conditions could lead to this kind of symptoms. I don't know the mom's age, so she might be at an age where she's at an increased risk of different conditions, including osteoporosis, including heart problems, diabetes, all sorts of different things. That should be explored, all that should be ruled out. If we have done that and we think, right, this is menopause that's going on, what kind of treatments have we looked at? That's what I would expect the doctor to be thinking about next. What kind of measures? Is HRT an option for you? Is it something that you'd be interested in? Is it something that you would like? If not, then we can look at non-HRT measures. And of course, on our channel, we've talked about both HRT, we've talked about non-HRT options for treatment, because I appreciate that there are some people who do not want to go down the route of HRT, or some who cannot even use HRT for different reasons. And so there are different things like exercise, diet changes, talking therapy, all of this put together that can help to improve the person's quality of life and manage the menopause symptoms. So that's what I think is really important. Going back to check, have we got the diagnosis right? Is there something else that we should be thinking about? What do you guys think? Let me see you guys on TikTok. Hello, what are you guys thinking? Does anybody have any thoughts around this menopause issue? Are you worried about the duration, or do you think this is not unusual? What is your experience? Guys, let me know. And then it would be good to see what you think. Okay, hi. Living Christ Gospel Ministries, Mother Church. Good job, Doctor. Thank you. I appreciate that. Let me know if you have any contributions to any of the points that we're talking about. So that's that for that particular question. Guys, we're going to take another break, a very quick one this time, I promise, and then we'll get on to the next question. See you in a moment. Okay, so we're back. This next comment question, well, this is for me because you guys know I run polls on YouTube. You guys need to come and join my YouTube, TikTok, Facebook, LinkedIn. Come and join my YouTube. I do lots of polls. Sometimes just trying to survey the community, and sometimes just trying to share information and see what you guys think. And I ran a poll on PCOS not too long ago, and I got some interesting results. I'm going to show you the screenshot of the poll, and if you go back to my channel, actually just go back maybe a couple of weeks, you'll see the poll is still on. But at the point where I got 600 votes or thereabouts, the question on the poll was, which of these is not a common treatment option for PCOS? Which of these is not a common treatment option for PCOS? So you might take a minute to sort of read or think about the question. What the question is looking for is a treatment option that is not common or commonly used for PCOS. So I went back and looked at the poll after about 500, 600 people thereabouts had responded. And I was very surprised by the results. The results that people from the different options I provided, metformin, that's a tablet called metformin that people will probably be more familiar with it for treating diabetes. The birth control pill was the second option. Physical therapy, that's exercise, physio, was the next option. And the last option was lifestyle changes like diet and exercise. Remember, the question is, which of these is not a common treatment option for PCOS? The majority of people that responded selected metformin. That is this drug that is commonly used for treating diabetes. And then about a third of people, or under a third of people, selected physical therapy, while some people selected birth control pill, and the smallest percentage went to lifestyle changes like diet and exercise. Guys on YouTube, LinkedIn and Facebook, I'm sharing with you the poll. I think I took the screenshot some days before I went back and then just summarized what I've just read out to you. You can see the question, you can see the options, and you can see clearly that most people were going for metformin. The reason I brought this up before you here tonight is because that was not the correct option. That was not the right option. And I felt, oh, right, something is going on here. People either don't know that about how metformin is also not just a drug for diabetes, but it's also used in PCOS. And I wanted to have a conversation. Now, PCOS, as you will know, again, many videos on our channel about this condition, polycystic ovary syndrome, where there are hormone imbalance issues, where a woman is not ovulating regularly, and so they have a lot of hormone imbalance with high androgen levels, as high testosterone, with low estrogen and progesterone, as well as other abnormal hormone balance issues, including insulin, growth hormone, and so on. And then PCOS has different symptoms. It can be on a spectrum where there can be a lot of facial acne or spots, hair, excessive hair on the face, for example, like I mentioned, irregular ovulation, so irregular periods, and for some there may be challenges with fertility. A very common problem, sometimes a struggle to diagnose, but we do have ways of treating, even though we don't have a cure for the condition. One of the ways of treating PCOS, and a common way for that matter, is the use of metformin. Yes, metformin. Even though many people did not select it, it is a common method for treating PCOS. What it does actually is to help to reduce insulin resistance, because remember, I've just said that in PCOS you have hormone imbalance issues. what metformin does is that it improves the insulin resistance that people with PCOS have, and that insulin resistance makes them more likely to develop diabetes. So by treating them with metformin, you reduce that insulin resistance, helping the body to manage insulin better and reduce their chance of developing diabetes. But it also helps to restore the ovulatory cycle. It also helps to restore the periods and increases the person's chance of becoming fertile and being able to have, children. So it is very well recognized. It is well supported by guidelines to use metformin in somebody with PCOS. The other thing that's useful treatment for PCOS is the pill. The pill can help to regulate the cycle. So for somebody who is at the stage where they're not yet ready to have a baby, they can be prescribed the birth control pill to help to regulate their period. The pill could also help to balance that excess testosterone or androgen that they have, because that's what's responsible for greasy, oily skin that can increase acne and even the facial hair. So some people can benefit from being on the pill for a period of time, especially if they're not trying for a baby at that point. The other thing that's extremely useful, important in PCOS is lifestyle changes like diet and exercise. So that is in itself is a common treatment option. People are encouraged, if they're overweight, to lose weight. Even if they're not overweight, they're encouraged to make sure they are on a good, healthy, nutritious diet and that they're physically active, simply to support their body, keep the body healthy, keep the cardiovascular system healthy, and so on. So the treatment of PCOS, let me take this off. The treatment of PCOS is not just one thing. It tends to be lots of different treatment methods or options, all different methods used at the same time to optimize the health of the individual. You want to target the insulin sensitivity. You want to make sure that they're a good, healthy weight so that you reduce the symptoms that they could have and, reduce the chances of complications like developing diabetes in the future or developing any other complications in the future. You want to increase their chances of being able to have a child when they're ready and so on. So physical therapy like yoga, physio, it's not generally it's not a common treatment for PCOS. If somebody who has PCOS needs to have physical therapy, for some maybe for having problems with their back or with their hips or their knees, of course they can go ahead and have physical therapy, but it's not something that we recognize as being a treatment option for PCOS, given the different problems that PCOS causes. So that is just an interesting one. I wanted to just bring it up because I know a lot of you guys who do my polls also watch this. So if you're watching this on the replay or you're watching this live, I hope that clears it up, that metformin is actually a common treatment option for PCOS. The answer to that poll was or is physical therapy. Physical therapy is not a common treatment option for PCOS, but the other three, metformin, the birth control pill, lifestyle changes like diet and exercise, are definitely common treatment options. Guys, this is where we're going to call it an evening. Okay, thank you so much for joining me. I hope you found one of these segments that we talked about useful. We've covered PCOS just now. We covered the L-shaped cervix and what to do in an instance where somebody's struggling with the idea of a biopsy under anesthesia. We've covered how a wart was misdiagnosed for a lymphangioma and the issues around that. And we've also talked about menopause symptoms going on for 15 years and wondering what is going on and what the next step should be. I hope you found that really useful, guys. If you did, please let me know in the comments section. Don't forget to give the video a like and of course subscribe to the channel. I will see you guys again real soon. Check out the latest video on the channel on genital warts. Please support that video. I thought it would do a lot better in terms of views than what it's doing at the moment, but who knows, maybe it's just slow to warm up. But you guys, if you're interested in it, please go and check it out and give it a like. I will see you guys again soon. Watch out for next week's video or this week's video actually, and it promises to be a really interesting one. Have a great week. Take care. Bye-bye. Okay, my friend. Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video. Hi, I'm Dr.